So the nasogastric process with getting the tube in and out is really easy once you get a system down. As you can see, I keep pretty organized with everything right here. I don't have to be running around the room to gather things. But you obviously start with your tube, pull it out of its packaging. As you can see, when you pull it out, it's really kind of rigid, and you know, it can cause a few problems if you're not used to it when you're putting it in, because it's not really straight. It's not as pliable. But one of the things I learned early on is that you can throw this under some hot water and it'll really become really pliable, and it'll slide down, you know, into your paths really easily. And sometimes adding a little lubricant at the end of the tube can also help. I find that the hot water trick is really helpful, and the lubricant actually just gets in the way after a while. But it's all about working a system for yourself that's effective. And the most important thing with that is you want about this much to be the most pliable part. This is really what matters and what will make it a lot easier. So moving quickly while this is still warm, you want to kind of have an idea of how far you're going to put this in your nose. So we're coming, you know, you're going to stick it around your ear and come down to about here. Your stomach sits about right here in your lower abdomen. So the tube's going to want to sit right about there. So if you can kind of have an idea perhaps of where this part on your tube, where the end will sit on your stomach, that'll give you a good idea of where you want or how far you want to put the tube in. Another suggestion is you can kind of measure that off again, and you can actually just put a piece of tape like right where it would come to your nose, so you know where to stop. So I'm going to have a piece of tape right here ready, and then also an empty syringe just goes on the end of this. We'll put some air through there once we get it down, so we know that we're in the right place with the stomach. So, you know, like I said, this is still kind of pliable, and that'll really help you. And when you're going in, first of all, have a cup of water with a straw next to you. That'll really help, and it's kind of almost necessary. I've never put it in without a little water to drink. But it's important that you're not going completely vertical with the tube. Go at kind of an angle of 45 degrees or so. That'll really help bringing it through and let it pass through kind of the transition between your nasal and your mouth, and where you're going to swallow the tube actually. Going vertical, it'll kind of hit, you know, your nasal membranes, and it'll really be uncomfortable. So it's kind of a fine line in angling that, and it'll make it a lot easier. So we're going to go in here like this. We're just going slowly here, and you're just, now right there I kind of hit the membrane, I could feel it, so you need to tilt it a little more. That'll help a lot. And it's totally normal for your eyes to water during this process. Mine still do, so don't be alarmed with that. All right, you'll get to kind of a point where you're kind of sliding along, it's not giving as easily. That's when you know, taking some drinks of water will help a lot. You're just taking a few drinks of water, and then as you do that, you're slowly pushing the tube through a little bit more. And when you get to where you think you're about, I know I know that I need to go a little further because I measured this to be up here. So we'll just go a little bit further. And it is a little weird feeling. I mean, it's a little bit uncomfortable when you're pushing it through. So just make sure you don't get weirded out, and just kind of go as slow as you need to. It'll take a little bit of time when you begin. It won't be so quick like this. But like I said, when you get a process going, it really will get a lot easier, and it'll become second nature, systematic. So we're about to that point, a little bit farther. And right there is about, right here should be about right. So we'll put some air through this, and I can kind of feel it right there. You can kind of feel the air coming in, and then you can also actually hear it, especially if you put a stethoscope on your stomach. You can really hear that you're in the right spot, and you do want to make sure that you are placed correctly, and that the tube did make it all the way to the stomach. So once we have it there, you want to get the tube tight to your cheek, and then just put some tape on there to secure it while you sleep. This product is actually called Tagaderm. It's a really thin type of tape that's used. It's almost like a skin. It's really thin, nice nice adhesive for skin. So that's really it, putting it in. When you connect this to your fluid bag or your reservoir, just make sure you tape this or something with something to hold that connection together. It's going to be really an unpleasant surprise if you wake up and this is actually disconnected and you've got formula pumping into your bed or whatever it is. That's happened before, so learn that the hard way. Make sure you tape that together so you don't roll over and disconnect it or something while you're sleeping. This is pretty comfortable for me. You'll get used to the feeling. You can talk, you can eat, you can drink. Everything is totally normal with this. It's just getting used to it. And get used to the feeling while you're sleeping as well. But anyway, you'll sleep through the night, hopefully no problem with this. And then when you wake up, you'll just peel the tape off. Just peel the tape off the tube. And then you're going to want to have some tissue handy. The tube could sometimes collect a lot of gunk on it, like your mucus and your stomach acid and such. So you're going to want to have something handy. But this is a really easy process. You're just going to want to kind of slowly pull it out. It's not painful at all or uncomfortable. Comes out just like that. And then, just kind of clean up. And that's really the whole process. And like I said, it's going to be most important that you just get a system down that works really well for you, that you're comfortable with. And then, after 10 or so times of doing it, you should be really proficient at it, and it will be second nature. Like I said, systematic and organization is really important. So that's really the whole process.